Hello, hi everybody. I'm very excited to do our first episode of the podcast with a very dear friend of mine, Dr. Anton Babushkin. Dr. Babushkin is an entrepreneur and a psychoanalyst. He's the founder of a pretty large private practice called Start My Wellness, based out of the Detroit metropolitan area. I've seen his journey for over the years as as a therapist, and then as a psychoanalyst, and now as a business leader. He has grown his practice and hires, I think, close to 20 therapists at this point and several nurse practitioners. The company has grown to a revenue of over $3 million a year, which is amazing, along with impacting so many lives in the area. So, I'm excited to welcome Dr. Babushkin. Dr. Babushkin, you can say hi.
Yeah. Thanks, Dr. Mishra. It's great to see you.
Great. So thank you for being my co-pilot on this first episode of the podcast. So one of the things I wanting to do with this podcast is really learn about people's professional journey, some aspects of their personal journey that got them to where they are today, how they're seeing the healthcare landscape, and maybe what are they looking for themselves in the future. So maybe we can start with a little bit about your childhood, early development before you kind of went through college and things like that.
For sure. By the way, it's 33 healthcare providers in my group now. But you made it sound great, so I think that's spot on. So, I mean, of course, you know this part, but I grew up in Russia, in Moscow. So I was born in 1982, so it was before the fall of the Soviet Union. And then my family, my parents, my sister, we moved to the U.S. in 1993, kind of under like a refugee, like Jewish refugee sort of status. Not that I really understood much about what that meant at the time. And then we came here, it was, early mid-90s. We lived in the Cleveland area for a few months. And then my parents found work in Detroit. So that's how we kind of settled here. And then there's kind of like a decently large Russian American population here, and then we kind of got established. My sister and I went to school, got our foothold, and now I've been in Michigan for like over 30 years. But I think your question, I think, is interesting because sometimes I think about what is that background of Russia, Moscow, the 80s and 90s have to do with being like in my leadership role now, right? And we can get into this at another time, but at least one thought I have about it is my parents, throughout most of that time, because of the way the economy was organized, it was very hard to make a good, kind of like the US is a little bit like this now. It was very hard to make a good sort of middle-class income just by working like a steady job, right? Both my parents were PhD level chemists, highly educated, hardworking, right? And they worked legitimate day jobs, but because the economy was sort of not very strong, it was very hard to advance. They would work kind of like side jobs. My dad was sort of like a driver for hire, like an Uber driver, driver for hire. My mom was a tutor for chemistry. She taught aerobics. You maybe coming from like an international background yourself, I think you can relate to that. So my parents kind of did work like that, sort of like entrepreneurial type work to make ends meet, because there wasn't a formal. You couldn't just say, I'm going to go into medicine, for instance. I'm going to complete, it's a long trail, but I'm going to complete residency. I'm going to do this. Then I'll have a, good paying job. That wasn't an option. So they kind of, so that's, I sometimes think about that as, how did I get into what I'm doing now? But, so that's a little bit of like, that's kind of the sort of my origin stories coming from that. And then, growing up in the US since I was age 10.
How was the, acculturation piece for you?
Getting used to American culture, I think it's like, what do they say about like eating an elephant, like one bite at a time? Well, in America, I think, so much talk about immigration these days, and like it's very heated rhetoric, but let alone the legal or otherwise stuff, just moving to another country, learning another language. Like my wife's Ukrainian, so she's kind of going through this process now, but it's such a incremental, it's like every day, on the one hand, you're learning new insights. You're like, wow, I understand this. I finally get it. On the other hand, there's so much to grasp and so many unknowns. You can only, I think in retrospect, when I look back at like year 10, year 20, you feel like, wow, I've come a long way. But those early days, every day you feel like you're just kind of try to break through like a glass ceiling almost of like, I don't understand the culture, the language, the connect. It's like and every day you're kind of like, it's like going to the gym. You're working out every single day. And then a year later, you say, wow, I've made some progress. But every day you're kind of like, oh, this is hard work. You know what I mean? So I'm glad I'm at where I'm at now, but I can't imagine, my parents were in their probably 50s, leaving their home country, going to a totally different place. Things new, like that's tough.
Right. And having children to support too. I think,
Yep, for sure. Children, exactly.
I'm an immigrant. I think the immigration journey comparatively was a lot easier because I was just by myself traveling to this country. It is not easy, but it is definitely easier when you don't have that level of responsibility moving
For
in.
sure. That's a good point. Yeah, that's true.
That's great. And so, how about when I think you first went into social work, right, and got your MSW. What was that kind of experience like? I believe then you went into your PhD program, right? So, what was the experience working as a social worker with an MSW, and then what gave you kind of the impulse to go and pursue your PhD?
So when I was in college, I was still just on the heels of getting used to America, right? I went to college when I was 17, so I was 7 years, after we moved here. So I was still, I spoke English, but I was still kind of very green in a sense. And I didn't know what I was pursuing, so I kind of like ended up studying environmental science, environmental studies. When I finished college, I was looking around at jobs. Like, what do I want to do? And I saw some job posts that were kind of like working with teenagers, helping them with like self-esteem or assertiveness or finding their way in the world. Maybe because I sort of unconsciously could relate to it. I didn't think about like, oh, that's also me, you know what I mean? But I was like, oh, I would like to do that. I want to help, that's a cool, you help people, right? So I saw this job post for like a social work type job. So I thought, okay, well, why don't I get a master's in social work, kind of see what it's like. So I go to the graduate program. I had some good professors, good mentors. And then I started working. And I think you see this yourself. You're a physician, but you're in that environment where when you're a social worker, sometimes you're working in kind of like not resource rich areas, right? Like agency settings where people have a lot of they're interesting people. The clientele is, has like these rich stories. You don't have a lot at your disposal. You don't have like tons of government money or organizational dollars. Like you're kind of like solving many problems just through like wits. Okay, today we got to troubleshoot somebody doesn't have transportation. How do we fix that? So I thought that was really interesting, but I felt kind of unempowered from like an institutional perspective, like an individual perspective. Like I was just learning the job, but also institutionally, I thought, well, I don't have much say in how this organization works, what we do, how we do it. So that was really tough. I thought, I want to try to at least advance my own career to where I'm a little bit more, have a seat at the table. You know what I mean? I didn't mind being the front line. I'm the helper, but I struggled with not knowing either how to get institutional support or where to get it, or if it was even, it wasn't like totally not available, but it was hard to get access to. So, both my parents are PhDs, my sister's a medical doctor. That was also, part of it is what I'm saying, part of it is like my family background. I thought, well, one way to advance is to go to, further graduate school, get my PhD. I'll learn more. I'll be more of an established professional. So that was like part, was sort of my thought process, was that it could help my career and also maybe put me in a position where I'm a little bit more heard, maybe where I could feel like more like my voice counts a little bit more.
I, before we move in the linear fashion, I do want to highlight something because I know of this, that you are very supportive of your frontline people. I can hear that not having that same experience didn't turn you into the same, right? You actually fixed it in how you're running. So can you relate to how are you doing it today? That's different than how you experienced it maybe.
Yeah, it's a helpful question because I remember, so when I finished my social work degree, while I was about to pursue my PhD, I was really interested in psychoanalysis, psychoanalytic training, subspecialty type of therapy. And so I had some mentors in that environment, but I was looking to get into like a nice clinic or a private practice, some kind of like non-community mental health environment where I felt I could focus more on therapy, not as much maybe case management. So I was part of this organization, sort of like a fledgling, new interested member, so to speak, of the community. And I looked through like our bulletin, like people who were graduate psychoanalysts in this in Michigan community. And I called every person on that list and I said, hey, my name is Anton, you don't know me. I'm really interested in psychoanalytic training, but I really need work experience. Like I need to like learn how to be a therapist. I need to work in a, some kind of environment. Do you know of any, I wasn't just saying, give me a job. I was saying, hey, do you know of any work environments, anybody who's hiring? So of the people who returned my call, which wasn't everybody, but of the people who returned my call, they all said, oh, I'd love to help, but I don't know. And, oh, like very nice, but not exactly practical. So I thought like, wow, I can't believe that somebody who is a motivated, hardworking, young, like early career professional who wants to learn, work hard, and really say, I want to be good at it. I want to do a good job. I want to work with others. I want to learn. What can I do it? No place to do it. That doesn't make any, I mean, I don't know. I thought like that's like weird. That inspired a lot, much of the work I do now in terms of educational richness, mentorship, getting to know people, like, you know what I mean? This kind of like professional development that I think many our generations, including ours, I think we sort of did it, try to like a pinball machine, hit your head in many directions. Eventually you'll find a way to fumble forward, you'll meet some people. We kind of had to do it that way. There's nothing wrong with that, but I think being available and trying to be helpful and nurturing others also is good. You know what I mean? It can be helpful.
Absolutely. I think there's a lot of, I think I call it information hoarding and gatekeeping that happens that, I remember sending hundreds of emails out when I needed an opportunity also in the past. That's great. I think it's good that there's also a shift. So oftentimes you hear about bad behavior being repeated by people who are on the receiving end, but I'm glad you're working on obviously shifting that. And so the people coming ahead will have a different experience.
And I'm sure future generations will say about me, they'll say, he was pretty good, but and that's okay. I'm okay with somebody, improving upon my approach, but you're right. I do think the hoarding sometimes maybe is intentional. Sometimes it's maybe the lack of if somebody's gone through their career and gotten established, they might not consciously be thinking, well, how did I do it? And how can I help somebody else do it? Like, I think you and I talk a lot about, hey, we're interested in leadership. Leadership means also, being there for others. How can we intentionally design pathways for, what I mean? I think you and I care about stuff like that. So, but anyway, so I think, yes, for sure. We try to improve upon what our professional parents did for us. We say when we're going to be parents, so to speak.
Many professional parents,
Exactly. That's right.
That's interesting. Yeah. So, okay. So you started your PhD and I think you were pursuing both your psychoanalytic training and PhD at the same time while also working. How did you manage?
Those were the busy years. Yeah.
Right. Well, you're still busy, but how did you manage that?
Yeah, it's a great question. One of the things that I learned to do maybe throughout that time is what I think of as extreme time management, meaning I try to identify exactly how much time is it going to take me to do a certain core part of the task. Maybe not the whole task, maybe not perfectly, but just what are the core parts of that task? How much time do I need? And how can I control my attention span? So for example, I have an hour. I have 40 minutes. I have to work hard. Then I got to jump in the car and go to another meeting. That means I can't be on TikTok or whatever. I got to do the 40 minutes, get it done, good enough. Turn it in, get that part done, move on. And so what I learned to do is to try to do 80 or 90% of the task, because I could always come back and maybe finish it, but 80 or 90%, and not lose time on saying, I guess I could just kind of not dilly-dallying and saying I have an objective. Plus, I sometimes I joke with myself. I have this a runner's lifestyle where I'm always I get one task done, then I got to run to the car because I'm running behind, jump behind the wheel, drive safely, go to the next appointment, finish. And I'm 42. I'm still running. I still run between appointments throughout the day. They're just different tasks, but I'm always okay, here I go, running in the parking lot. So it's time management, I guess.
Yeah. I mean, time management is such a critical piece. I remember that 1 hour example. I would need 20 minutes to get to the next appointment, but I would never account for those 20 minutes. And, it's 9 and my next appointment is at 9, which is fine, but it is 20 minutes away. The iPhone calendar actually helped save my life.
What I think is kind of fun these days is because we're so technology interlinked. The other day, I was in a similar situation. I double booked my time, but I was able to get my car has like a Zoom integration. So I was able to be in the car
Yeah.
without looking at the screen when I was driving, but I was
Right.
present. I was like, hey, I have to take this from my mobile office today.
Right.
And, you know what I mean? So I think, I try, you know, we try not to do that, but that
Yeah.
sometimes can work.
Right. I think once you were done with your PhD, close to that or right after it, you took the jump of becoming a business owner, because I believe you were an employee till that point in a private practice, right?
I had this really good mentor, Marvin Margolis, who connected me with my former boss, Lori Edelson, Maple Clinic. It was great, you know, a really great place to work. So I had worked there for 5 years. I thought I was, you know, on great terms with my boss. I had a really good experience. I learned a lot. But by the end of that 5 years, I had finished my PhD and I thought, you know, it's a good environment, but I felt this internal kind of like not exactly fully articulated desire to like lead my own organization. I didn't know what I would do exactly, what it would look like, but when I would read articles about like business and stuff, I would think, wow, I feel myself doing that. I want to do that. And so I left this kind of like safe, you know, good environment to start my own solo practice because I thought like if I don't do, I'll regret it. You know, if I don't kind of branch out and try it, I'm just gonna not feel good about my career. And so that was my initial kind of foray into. I remember you came to my first office at that time. We had a fun chat about what if this doesn't work out, but that was kind of a
Right.
first leap into the private, you know, the business ownership.
I remember seeing your office and I said, "Oh wow, this is amazing! Like you have your own office, right?" And I'm currently renting a Regis co-working space office, which I feel even good about that. You know, I have I have a place that's not near my kitchen that I'm working
For
from.
sure.
Yeah. That's starting the business. What were some of the fears and how did you manage some of the anxiety that comes with giving up that security and taking that leap?
I mean, yeah, I think the hardest part, of course, is we all need some amount of money to support ourselves, right? Like most of us work, you know, for an income. And so going from the security of I'm an employee, my boss kind of looks out for, you know, my productivity. I have people around me who like, if I'm in trouble, I could kind of, you know, it was a private practice environment, but I had a lot of support. So saying, okay, it's like my sister says, you know, in her world, you eat what you kill. Like if you don't get the referrals, you're in trouble, right? And so it was definitely, I think what helped me is that I felt like an internal sense of I'm willing to work to make this happen. You know what I mean? I had like a feeling that, yeah, there's a risk of running out of money, not having, you know, business, not having referrals. But the positive side was I felt like, well, I was probably, what was it, 2015? So 10 years ago, I was 32 years old. So I was like, you know, fairly young, so to speak. I didn't have a family to support. I mean, I was in a relationship, but I didn't have like kids. And I thought, well, no matter what happens, I think I'll be able to work my way out of it. You know, I'll be able to kind of put in enough elbow grease to make it work. That was probably the main thing that helped me overcome and then what I would do is I would say, well, what's the best way to do that? Wake up early, get to work right away. Don't stop working until it's late in the evening, and then go to bed and do it again. And that will be the best way to ensure that the next day I have food on the
Yeah.
table, so to speak.
It's the best secret sauce. Work really hard.
For sure. For sure. It's not easy to do because it's easy to get discouraged, demotivated, complacent. You know what I mean? Like these days, my business is a little bit more established. I guess it's sort of easier to say, oh, you know, I could kind of relax a little bit, but I try to remember that, you know, you're only as good as you won't always want to challenge yourself. You don't want to sit around too much. Like, I think it's good to enjoy some time off, but you don't want to, I don't think I'm not a huge fan of saying, oh, look at what I've done. I like to say, I like my accomplishments, but what's coming next?
Right. And I mean, you're an inspiration to me too. I'm kind of where you were 10 years ago. having just left an amazing full-time role and getting paid well, to going, less than half of what I was making a couple of months ago. And also questioning some days, why am I doing this? Maybe I can go find another job. But at the same time, thinking I really want to do this. I want to give this a shot. And also that you have something to add that's different. They're different than maybe what's out there.
And the feeling, I think exactly what you're saying, the feeling of ownership. This is your project. It's what you care about. Your values are invested in it. Your life experience kind of infuses, your professional life experience kind of guides some of what you're going to do. A lot of that, I think, is very, by itself, that is rewarding because you get to kind of create and craft your own future to some degree. You know what I mean? Like, yeah, the risk is, financial and otherwise, but at the very least, kind of like from cloth, kind of, you're kind of building together, like you're stitching together what you want your professional life to be. I think it's scary, but it's a rewarding experience.
So maybe let's talk a little bit about the journey of being the business owner, or kind of building the business separate from the clinical skill set that you obviously work years to gain, because that's a separate journey altogether. So what was some of that, and maybe some pain points, and what some learnings along the way there?
I think being a business owner can be a very, very difficult job. I remember I have this mentor, I have this like sort of friend, a psychoanalyst. One day I was talking to him about being a business, I'm a psychoanalyst too. I was talking to him and he said, well, psychoanalysis is hard, but maybe like entrepreneurship is just not that hard, right? And I don't want to say like, I'm sorry, but you don't have any frame of reference, because actually, I wouldn't say it's harder necessarily. Being a therapist, a clinician, a psychoanalyst can be very, very challenging. But being a business owner is equally, there's so many unknowns, right? Like every day, you're confronting things that, for example, this is true for both of us. Like we grew up as clinicians first and got into management business stuff later, right? I never took a business class as an undergraduate. I had worked at companies, right? I worked at a startup when I was in college. I had worked at the private clinic, for a while. That was, so I learned things I worked at a few hospital systems, but I never done a business on my own. I never like sold lemonade, or, you know what I mean? I never ran a business. I never looked at financial documents, tax documents, leases, legal things. The good news for me at the time was when I started a solo practice, it wasn't like I didn't have to make a decision about, like right now I run a group of about 40, it's a group of total like clinicians plus admins, like 40 people. Well, when I make a decision, I have to think about the ramifications of that decision for a larger group and more people. When I was a solo practitioner, of course, it still affected me, but I had to think about kind of, okay, how is this going to affect me or whatever. So that was a little bit easier, but it was definitely a lot of doing and figuring out without knowing exactly what I'm doing, kind of like learning by doing, or doing and thinking, okay, this is my best guess or my best judgment of how to do this. I'm going to do it today. And then a year or two later, I would reflect upon that and say, that was pretty good. Your instincts were reasonable, but now that you know a little bit more, here's something you didn't see. You know what I mean? So a lot of it was kind of doing in the moment. Like, it's like if you have to make breakfast and you're like, well, I'll just use the ingredients I have on hand. Well, once you made breakfast, you're like, okay, I can go to the grocery store and maybe pick up something that's actually edible, or, I actually want to eat. So it's kind of like doing the stuff every day, running the business gave me a little bit of room to breathe, where I was like, oh, okay, well, the business is kind of at least up and running. Maybe I could take an hour or two to sort of think about strategically, you know what I mean? So that kind of was like so that was like the very early period of trying to use my best judgment, or people, asking friends, colleagues, like, well, how to do stuff. But primarily, I think similar to like the experience of being an immigrant, primarily what helped me was a desire to continue learning. It's kind of like a feeling of, I don't care what it takes. I want to achieve these outcomes. If that means I have to kind of hit my head against the wall 10 times, so to speak, to figure out something I didn't know, like I was willing to say, yeah, I still do this now. If like a few years ago, we were just starting to do some digital marketing. I didn't know anything about digital marketing, but my mindset was, I will do what it takes to get good at digital marketing because it matters for my business. I don't care what that means.
You're right.
It doesn't matter to me what it takes. So that kind of approach, I think it doesn't have to be that, that's maybe a little bit on the extreme side, but that's my feeling is I just don't care as long as I could reach the desired outcome. I will do what I need to do to make that happen.
Yeah, I think I mean, that's interesting because one of the mistakes that maybe a lot of clinicians do, and I've definitely made them, is that because we are experts in one field and we are licensed, we assume we are experts in everything, which we definitely are not, right? And so I think it is important to, you have to reframe yourself to enter this learning stage again. And you're almost learning from scratch in a field that you don't know anything about, really. So again, that's something I relate to definitely at this moment, trying to figure out, website design and trying to figure out how to message what you want to offer. All of
For
that
sure.
has to get figured out and thought about. Also, unlike healthcare, where almost in a training program, your mentorship is already built in to a big part. Whereas here, you have to go and look for mentors on your own, and there's nobody wanting your business to succeed other than you yourself and your drive.
Right. That's 100% true. And I think it's very hard to go from I know what I'm doing, for example, as a clinician, right? To now I don't know what I'm doing as a business owner. That's an unpleasant, it's not a bad feeling, but it's unpleasant. You're kind of like going to like this unknown thing, and you have to walk that path for a long, it doesn't mean you're doing everything wrong, but you have to kind of walk that path for a long time. I used to
Right.
feel really bad. Like a few years ago, I think, wow, I feel bad that I'm asking people to rely on me as a leader, because if you asked me as a clinician, as a therapist, as a psychoanalyst, I'd say, hey, I'm pretty experienced, like more than your,
Right.
more than a recent grade, I'm like fairly experienced. Hey, I can give you my perspective. I could try to help. I blah, blah, blah. But if you ask me as a business owner, I'm like, this is just my best estimate right now. And I felt bad. I felt like I was kind of not exactly letting people down, because I was still doing like, okay job or reasonable.
Mhm.
But I certainly knew that my experience, knowledge base, skill level, mentor, like professional network was nowhere near. It was so lopsided. It was like entry level business owner, fairly experienced clinician. That's it. It's okay. I mean, it's a good path, but it's not an easy path. And you have to like kind of like eat crow. You have to be like, okay, I accept,
Right.
I acknowledge it. I'm not the best that I can be today, but I
Right.
will be I will be the best, whatever.
That's so interesting. I think, because I have also have stories of this, realizing, okay, I may be a great clinician or a good clinician, but at this moment in this leadership role, I need to learn a lot more. Do you remember an example that kind of clicked? Okay, I need to invest more in this.
Here's an example. I worked with this patient one time who was in the business world, and he was talking about something, and I was already, like at least on my own practice. And he was talking about something like about his work, like not related to me. And he said, yeah, this is a balance sheet issue, not a income statement issue. And I'm kind of like, yeah, yeah, yeah. Yeah, I get it.
Right.
But I'm thinking like, what's a balance sheet? Like what's an income statement? I don't know what that means. And so I kind of asked him, I'm like, hey, just curious, like, what do you mean? And it made me realize that something that's, again, I'm not an accountant. I'm not saying I'm the most knowledgeable person about that. I'm just saying that I was like, wow, even what's fundamental or basic, or like, here's another example. He was talking about some project or whatever at work. And when they were pitching the project, he said, oh, they were doing like a sale. And he said, what are the metrics that are going to make this project, like to the buyer? He said, okay, you want to buy our service. What metrics are we going to use 3 months from now to know, both of us, that this was either a success, keep going, or not a success? And I thought like, oh my gosh, that's so smart. How come I didn't how come I didn't know that? Like that sounds completely reasonable and logical, So like those, I mean, that's just like a sort of a funny, playful, real example. It made me think like, oh my gosh, I don't know. I'm illiterate. You know what I mean? I'm not, it's like when you come to the US, right? You could learn to speak English through TV conversations, but like if you don't formally study, I don't know, sentence structure, you know what I mean? If you don't like learn how to read, so to speak, you're still fluent in the language, but you're less fluent than you would be if you, knew a little bit of history or a little bit of language or a little bit of, I don't know, vocabulary. You know what I mean? Like you're a little bit less fluent.
That humility is so critical, and it's also so tough because I think the clinical training I think the part of culture of clinical training is gives you so much confidence in your opinion that it is hard to then say, I don't know this, right? And but it is so important to actually say that.
Especially because you're not only saying, I don't know this to yourself, you are going to go into sales meetings, recruitment meetings, budget meetings, all kinds of stuff.
Right.
Not because you won't know anything, but you have to go into the meeting saying, I'm going to use what I know and my like wits to figure out what to do, but I'm not walking in as like an expert. You know what I mean? Like now when I go to a business meeting, I'm not going to say I'm like the world expert, but at least I can say, hey, I have 10 years of doing this. I have some expertise.
Right.
But 9 years ago, I would say like, okay, I'll go into the meeting, but I'll do my best. So that's not, and you're asking people to like take a chance on you, rely on you, buy your services, even though you're not yet, there's something to be said about initiative and being kind of open-minded and kind of like having learner's mind, but it's hard. You have to kind of brace yourself for, I will face things that I don't know. I won't understand them and I'm going to feel bad. And then I'm going to need to scour my professional network or anywhere, anybody who's going to help me decipher the things that I don't know. And then over time, I will understand them.
Yeah, I mean, in my last job, I started in a pretty senior chief behavioral health officer, senior leadership role. And I was coming from working for the county for about 4.5 years. People loved me there. Patients liked me there. So I was coming with, I know everything. I came in, started talking about changing system and this and that. Long before I actually understood the system, right? And so a lot of people who down the years became really good. They liked my work and supported me, where it gave me so much pushback that early first 6 months, rightfully so, because I didn't really know what I was talking about yet. So that was a good experience to be reminded of something you have to work on and learn and invest time, money, and effort in, just like you did for your clinical trainings for so long.
Yeah, it's tough. And I remember you and I used to talk about like graduate programs in business, and I was like, I don't know. That our conversations and partially that kind of like realizations made me think like, I should take some business classes because if I'm going to be in the world of business, I have to at least be able to kind of, speak the language and understand some basic ideas and concepts,
I mean, I found the MBA too also very useful because the clinical training gives you, there's one patient, one diagnosis, one treatment. Whereas in the business world or in the MBA, or I think people probably get that through MPH also, there is a much broader lens that you're looking at the system and the problem at, which is very helpful for sure. Okay. You're doing both business leadership, but you're also a clinical leader, right? Do you see the differences in that role or how you approach it?
Yeah, it's a tough balance because sometimes I have to think about which hat am I wearing in what particular meeting. You know what I mean? If an individual meeting, like today, I met with a clinician at the office about kind of a supervisory issue or an issue of patient care. Very interesting. We kind of thought through it together. He had a useful observation. I offered my perspective. That was kind of like interesting. And sometimes I'm talking to clinicians about contracts or about what kind of income they want to achieve working with my group or stuff. I mean, it's interesting. I think what ended up happening for me, which this is something I'm working on now, is I was so head down, need to develop my business skills and truly provide value for a while that I kind of almost like outsourced the clinical leadership too much. I kind of would say, okay, we'll help you find a different supervisor. We'd still like work really hard to get the resources, just not through me, because I felt like, hey, if I'm going to run this group, I got to deliver economic value. People are looking to me for economic results, and I got to deliver that. And so I was like, head down, work hard on that. But then kind of with the influence of my friend and colleague, Dr. Bill Bloom, who's a very experienced licensed psychologist, I would have these meetings with him. He'd say, hey, Anton, you're also an experienced therapist. You're a psychoanalyst. Like I mean, yes, you're a business owner. You like that, but you're
Right.
also really care about patient care. You know what I mean? So he like through like him and a few other colleagues, I sort of like remembered or kind of like rebalanced almost like my own perspective of myself. Like, yes, I care about business, but I also like I see patients now. I find it really interesting, rewarding, challenge. It's very like rewarding work. So I think it's, I guess the way I try to do it is I try to remember that both things matter to me and that
Right.
both things matter to the people in my organization. They don't only want economic results. Of course they do, but they
Right.
also want collegial, maybe educational or camaraderie. They want to learn together. They want to, some of the people that end up working with me came out of
Mhm.
classes I taught because they thought, hey, he's a reasonably experienced clinician, not because they know that I know how to look at an income statement and look at the costs and say, oh, year over year, we got to reduce this category because it's X percentage of our total revenue. Well, I do know how to do that. And I sort of wear the
Right.
CFO hat,
Right.
time to time. But kind of, I don't know if that, I don't know if I can articulate it fully, but it was kind of like a personal, like I don't have to just be one or the other. You know what I mean? I care about clinical work and connecting with colleagues and clinicians. And I care about economic, like I think being successful economically means you have more freedom to kind of live the life you want or make choices that are
Right.
in line with what you care about. You know what I mean? So I think I kind of had to learn for myself that they both matter. And so that helps me to show up in both, I don't have to just choose one or the other because I'm more accepting of those both parts of myself. You know what I mean? So I feel like I can show up in both ways. I guess, depending on the context at work. So I don't know. That's it's still something I'm honestly working on. It's not a I wouldn't say I know exactly how to do that.
Yeah, I think that it's probably a good thing for it to be a constant rebalancing, because I think it is also when the team also sees that you're clinically aligned and your thinking is out there and you make it public, right? Which is also you're opening it up to question and judgment or whatever. At the same time, I think they are probably more likely to go along with you when you are taking bigger risks in business, or maybe support you more because they look at you as somebody who's ethical and trying to do the right thing.
Yeah, and you're right. I think it matters because we do try to do the right thing clinically and help others do the same. And I think that helps to develop trust, a connection, right? That which is so important. And then we try to when we make decisions as a business, we try to balance what's the balance on growing the company or like recruiting people versus how does that affect our ability to deliver good clinical service? You know what I mean? It's kind of like,
Right.
so I think they're both just like really interesting endeavors, but for the connection and the trust you're talking about, I think it matters. It matters a lot.
What are some of the gaps you're seeing today from the perspective of a clinician and a private practice business owner that you feel are critical for them to be solved?
Well, I think there's sort of several layers, right? I mean, on the one hand, we have the public versus private system. When you're using state insurance, government insurance, sometimes access can be more difficult depending on which providers accept your insurance, so that's one level, right? We're more in the private practice world. We take like commercial insurance users. We do work with Medicare, but I think one of the things that I see is the patient, the person doesn't have the same knowledge of the system necessarily as the clinician, meaning what's the reputation of other clinicians? What's that based on? What kind of services they might need? What might be unnecessary? Now, those are all like professional opinions, right? They're not like total, it's not like I know exactly what all that is. But from my point of view, sometimes the person will have a hard time knowing, okay, what kind of evaluation do I need? And how would that work? And who would I go to or who's trustworthy? And that's not easy to find because just reading about somebody online, that's a good start, but there's so many factors that go into that. And so we try like Bill Bloom and I try very hard to, we have our own podcast, for example, where we talk about we connect with like colleagues in the community who we think highly of or we think do a good job. So we try to kind of have conversations with them that highlight this might be a good resource or this might be somebody who could help. We do it for educational reasons, but we also do it because that kind of coordination of care, knowing who to go to, why that person, what should the outcome look like, that's like a lot harder to know for the patient sometimes than maybe for the mental health professional. So sometimes we talk to companies, like, we do some corporate mental health where we help employees of firms. Well, sometimes we talk with their HR departments about we could be a resource to either the HR or the employees about, I don't know, like Bill Bloom, right? He's a psychologist. So he does ADHD evaluations or many types of neuropsych evals. Many times he'll get on a call with somebody and he'll talk to the person and he'll say, oh, I could see you might not need, you might need this, but you might not need a full evaluation like this. Here's, because he knows how to do those evaluations, he can kind of get a sense of what the person might, which would be hard to tell for the individual who's making the call. Same thing.
Right.
I mean, you probably see this yourself. Same thing for me as a clinician, as a therapist, as a
Yeah.
psychoanalyst. When I talk to a new potential patient, I'm already, based on my professional experience, formulating in my mind, oh, these are the areas that I think the person may want to, get help with or focus on. And I could make that kind of initial, even like recommendation based on a phone call, something that it's many years kind of in the making, right? But the patient doesn't always have that knowledge or where to find, one, what do they need help with? And two, where to get the help, right? We try to do this through it could be Google reviews, or it could be like we try to put out a lot of content on the internet to basically say, hey, you could kind of learn more about us. You know what I mean? We, like, when I recruit clinicians, I try to say, we want you to make an informed decision. We want to try to get to know you, but we want you to get to know who we are so that you're making an informed choice about, to whatever degree is possible, about who you're going to work with. And same for the patient. You want to try to help the person make an informed decision about why are they getting this kind of help and from whom.
Right. Yeah. I mean, it's so critical because care coordination is almost the most difficult piece of healthcare itself. You may be an excellent clinician, but there are patients who walk into your office that you can help them with some of it, but they need a lot of different pieces. Clinicians spend a lot of time trying to help patients navigate, right? So if that information is more easily available to a frontline clinician, it just makes their life a lot easier for sure. I mean, I see the same issue here
Care
in San
navigation
Diego.
is it's so critical. The care navigation is so hard to do because even if you're an experienced clinician, you might not always know how to navigate the healthcare landscape of who's the payer, in what system. You know what I mean? There's so many levers to pull that it's tough, but it is also, it's just like anything else we're talking about. With enough motivation or kind of assistance, I think that it is navigatable, but you have to kind of be persistent and you have to be a good advocate for yourself.
I think that's important for you as a leader thinking about this. I think that's important for leaders to think about because a lot of the burden and burnout of clinical work doesn't come from the work itself, but all of the other add-on things you have to offer the patient because patients have many needs. So if you can make that easier for your team, that is a great way to reduce burnout and retain people, I think, long term, because you as a leader are thinking about it already.
Well, one of the things that I find these days is we were talking about kind of time management, right?
Yeah.
I find that like using AI tools, for example, can help with certain tasks. Like I could write an email, right? I'll write a draft, I'll edit it through AI to kind of improve the flow of the text. Well, that just saved me maybe 20 minutes. And if I have to write 10 emails, well, that's a lot of time saved, right? So same thing with like care navigation to some degree. Like sometimes if I don't know where to start with a question, I'll type I use I'm agnostic. I use every AI program that I know of because I think they all have different strengths and weaknesses. So I'll type in the same question to all the different chatbots, and I'll sort of think like, I don't know where to get started with this particular question. What do you think is a starting point? The AI model will give me some ideas, and that's just like a brainstorm. Then I say, okay, let me go to Bill, and I'll say, hey, Bill, this is what I'm thinking about doing. How does that sound to you? You know what I mean? So there's like a lot of I think there's some degree of technology that can be useful for reducing. I mean, it's not perfect, but it can reduce some of the roadblocks because you're not kind of single-handedly trying to do it through like a paper and pencil. You know what I mean?
Right, right. And also, as you mentioned, Bill, I think the other important piece is to have people in your circle and your team who are able to question why you're doing something. We used to call it poking holes in the plan. Some plans sound so nice, especially if you're just talking to ourselves, right? And to have that other external input can be hugely, hugely impactful.
Oh my gosh. Every day I try to, whenever I meet somebody who I think has a point of view that challenges what I know or see that they can kind of like have a grasp on something I don't know, I try to reach out to that person and say, hey, such and such, could I like stay in touch with you? Can I call you occasionally, like on Zoom or something? Because those counterfactuals, you can't put a price on that. Some things you can have a conversation with somebody that makes you realize important ideas that may take you a long time. I think those like there's almost nothing more valuable than having a few trusted people on your Rolodex who can kind of say, hey, Dr. Mishra, I'm thinking about doing this thing. What do you think? And Dr. Mishra says, I don't know. Oh, so it's like, I think you gotta, it's not easy to do because those people they're not like just standing on a street corner saying, I'll mentor you, but I try to make it a regular practice. Like anytime I hear, if I read an article, if I read the Wall Street Journal and somebody makes a good point, I look them up on Amazon and say, did they ever write a book I can read? If they have an email address, I send them an email and say, hey, I really liked what you said in this article. Can I ever chat with you? Or I look for their podcast, or I look for any kind of thing that they've had a conversation with. 90% of the time, they don't answer. But 10% of the time, they do answer. And then you get to have these interesting, and then you learn, and then you develop your knowledge base, you develop your professional network.
I think in the 1950s, maybe the culture of leadership was you need to appear to know everything, and that's just not there anymore. I think probably one of the most important traits you look for is actually humility and curiosity and wanting to learn, right? And open to learn itself.
I would just add one thing to that, which is I think what helps is like even in our professional fields, nobody would say you go like let's say as a psychoanalyst, you don't do psychoanalytic training so that you know everything in the world of psychoanalysis about every whatever. You do it so you develop a psychoanalytic mind, an identity, a thought process, a way of understanding and troubleshooting the world from a particular vantage point, which then you're going to have to use and further develop in unknown or unfamiliar situations. So I think leadership to me is the same thing. You have a standard issue, maybe some experience, you've worked at some companies, maybe some business training, whatever. Then you're going to take your standard issue. This is like the things that I know. And then you're going to need to use that to troubleshoot, learn, apply, and relearn new, unfamiliar, unforeseen situations, which will then enhance your, hopefully, ability to think through and troubleshoot. And then you're going to approach the next problem with a little bit more, no.
Yeah, and exactly, like your real life problems are not going to be like business school case studies. Those are perfect problems that were probably solved perfectly. That's why they're being talked about so openly. And you're going to have probably a lot more messy problems. Any words of wisdom for people thinking about a career in social work and wanting to be a therapist or clinician?
Well, I think the world of therapy and mental health in general, I think is a really interesting, rewarding career path and very promising because I think there's more appreciation in today's world about how our kind of experience of the world is very individualized. It's guided by our upbringing, culture, community, physical kind of, makeup. And I think it's a really interesting field because more people around the world care about, they want to understand themselves. They want to live hopefully a good quality of life. They want to take care of others. They want to be effective. So I think it's a really great career, but I think the hard part is you have to work really hard to be good at it. You have to like be willing to say, I will commit to a professional goal of continuous improvement. That's the hard part, is that you don't become a clinician or a leader by saying, hey, I did this for a couple of years. I got it. I mean, it's good to be confident, but it's more like I did this I've been a therapist now for, I don't know, almost 20 years. Yeah, I mean, I think working hard, being willing to learn, and I think trying to find your own path. Like to me, the path of being in leadership in the mental health field was not something that I maybe initially considered or thought about or even conceptualized. And because like the way I'm running my own company, I didn't have, not that there were zero examples, but there wasn't, I don't know of other psychoanalysts turned business leaders who are trying to do, not that I'm that unique, but trying to do things the way that I care about them. So sometimes you have enough role models who help you with some ideas, but you kind of have to find your own way and find which way of being a mental health professional works for who I am, my personality, my goals, my community. You know what I mean?
Great. Yeah. I do know that this will be useful for any young clinicians or also people who are thinking about leadership. Do you want to tell us a little bit about your business and maybe tell people if somebody's listening in the Detroit metro area where to reach out for help?
For sure. Thanks, Mr. Well, basically, I mean, we're a private practice environment. So we have over 30 clinicians, and our basic goal is helping people improve their quality of life. So quality of life usually means, how do I take care of myself? How do I take care of my family? How do I manage my healthcare, like health symptoms, like anxiety, depression, relationships? So that could be therapy. It could be medication. It could be like a good evaluation for ADHD or autism, things like that. And it means usually treatment or some kind of help to help the person kind of on their way to improving their life. Well, we work, we have 3 locations, and we have two small offices and our main office in Metro Detroit. And we work virtually, we work in person. And essentially, we try to recruit people who care about human well-being, kind of human flourishment, and we try to create a good environment for the clinician and help them be helpful to their patients. And we try, and one of the unique things that we do, I think, is that we have a lot of learning communities within my office. Like we have a case conference community, we have a professional development seminar every week, we have a child case seminar, we are about to have a couples therapy seminar, like regular seminars. We're going to do trauma treatment seminars. So we're always trying to create new communities of clinicians within our group. We learn from each other. We have invite expert speakers because we always want to both connect with each other and advance our learning. So that's like one of the things that we do through many different channels to try to create, a good environment. It's a lot of fun. I mean, it's a lot of work, but it's also can be a lot of fun. And we try to be kind of just work with integrity and do our best.
So people can find you on startmywellness.com. Is that correct?
Exactly. Yeah. Thank you. Startmywellness.com. They can call us or they can go to our website. Our phone number is 248-514-4955 for anybody who uses the phone. But yeah, our website is a great way to find us. You can find us on Google. Even ChatGPT recommends us as a good place in the Metro Detroit area. But yeah, that's thanks for mentioning that. We are a community resource in many ways, and sometimes when if we're not the right fit for the patient, we try to say, hey, this might be a good option for you. Or sometimes we might have a wait list for some services. We say, okay, if that's not a possibility for you, we'll try to refer you. So we try to respond, and we always try to improve our process. We try to get the patient in quickly, make sure we know, how much they might owe. We always try to work on customer service as a part of what we do.
I just want to mention anybody who's watching that, there's no financial conflict of interest here, but, I've seen Dr. Babushkin through his journey of becoming, a psychologist, a clinician, and also becoming a psychoanalyst, starting his business from the one office that he mentioned earlier, which I remember visiting, to a huge practice. So I can definitely recommend. He has a strong team, and he himself is a great clinical leader, driving that team forward. So please reach out if you need help. Again, thanks so much, Anton and Dr. Babushkin. This has been a pleasure, and I appreciate you getting on this first podcast wild ride of internet interruptions. But yeah, thank you so much.
If I could say one word, Dr. Mishra, sometimes I think about, is there an additional value of being a clinician to being a business owner? And you're a good example of that, because this probably is the most thoughtful, well-posed question interview. I mean, there's many interviews that I do that I think are interesting, but your natural flow of asking really thoughtful, unique, intuitive questions and being really in tune with the speaker comes through. Now, I mean, I think that's who you are as a person, but part of your professional background, it's very rewarding. I think if anybody is watching this, I would say you should get on Dr. Mishra's podcast. Just the experience itself is so fun and rewarding. I would do it again just because it feels great to be interviewed by you. So I think this is very enjoyable, and It's been a really nice opportunity for me.
Thank you so much. Yeah. And by the way, if the internet doesn't upload, you will need to do it again, but it will upload.
Okay, no problem. Sounds
That's
good.
what-
Sounds
Again,
good.
thank you so
Okay,
much.
thanks, Gaurav. It was great to see you.
Take
Appreciate it.
care.
Take care.
Bye.